Welcome back to the PSA Couch, where today I'm joined by Kayla Lee and Ravi Sharma. We're talking about pharmacists prescribing. So, Ravi, I really wanted to ask you, what does the evidence show in terms of the benefits for patients of pharmacists prescribing?
Well, across the globe, there's a massive growing amount of evidence around the benefits that pharmacist prescribers have in improving patient care and safety. There are four key areas. It has been shown that pharmacist prescribers can help improve the way care is being delivered, can help improve patient care and safety, improve access to the right medicines at the right time for the right individual, and lastly, increase the collaborative nature of prescribing with other healthcare professionals across healthcare systems.
So, in terms of access, then, Kayla, what would it mean then, maybe for Australians who are in, our more rural and regional parts of the country?
I think it would improve access substantially for these communities. The statistics show that those living in rural and remote communities do have poorer health outcomes and also higher hospital admissions that could be prevented. And pharmacist prescribing would improve access to these services, reduce the burden on GP wait time, and improve the quality of life for Australians living in rural and remote areas.
So, Ravi, how does pharmacist prescribing support patient-centered healthcare?
Well, there's a number of areas in which pharmacist prescribing can improve these patient-centered care. Firstly, from an access perspective, so being able to increase the number of appointments that are being offered in the community, for instance, and therefore enabling a reduction in waiting times for appointments. There is evidence that showcases that pharmacist prescribing can reduce adverse drug reactions related to medicines, but also be able to reduce hospital admissions that are avoidable related to medicines as well. But lastly, the evidence is also showing that patients really enjoy working collaboratively with pharmacist prescribers. They enjoy the conversation, they feel more confident about their use of their medicines, and even better, the healthcare professionals are also demonstrating the benefits and advocating for the use and the good practice of pharmacists collaborating with them on this agenda.
So, Kayla, if pharmacist prescribing supports access to healthcare, how could you see that prescribing in your pharmacy in Waniasa would help your patients?
I think prescribing would help our patients fill that continuity of care circle that we're all trying to achieve. ECPs and other pharmacists want to work collaboratively within the healthcare team, and pharmacist prescribing would enable that. We can improve medication management and optimization through that, and we can avoid patients going without their medication if they can't get into the GP, but also providing referral back to their GP to complete that circle of care.
So it really is about patient-centered care, isn't it?
Patient-centered care is patients always at the centre, and we want to be on the outside with the GPs, with the psychiatrists, with the psychologists, and filling that gap.
That's fantastic. Ravi, obviously, when we start talking about pharmacist prescribing, there are some concerns around the medical fraternity, around where do roles start and stop. What advice would you give Australian doctors and Australian pharmacists in terms of addressing that issue?
Well, I think this is absolutely about putting the members of the public at the heart of absolutely everything we do. Pharmacist values are exactly the same as other healthcare professionals, including our doctor colleagues. It's about putting the person at the heart of absolutely everything we do and ensuring they get the best out of their healthcare. In the United Kingdom, for instance, the doctors and pharmacists work collaboratively along this agenda and have been working collaboratively for the last 5, 10, 20 years around ensuring people get the best use out of their medicines. If anything, pharmacist prescribing improves those relationships and, most importantly, ensures the publics get the best out of their medicines.
Well, Ravi Sharma and Kayla Lee, thank you for joining me on the PSA Couch today.
Thank you for having us.